Hey, this is Rick Kaselj from exercisesforinjuries.com. Today I have another interview for you, and what we're going to talk about is kind of the ugly side of medication. So today who I have is Kevin, and I'll get Kevin to introduce himself and kind of give a little bit of a background on who you are.
All right. Yeah, I'm Dr. Kevin Cuccaro. I'm a physician trained in anesthesia as well as fellowship trained in pain medicine. And I sort of got into this with a frustration in the pain field. And, despite all my training, despite what I was doing, I was teaching doctors, I was teaching residents, I wasn't seeing people get really better. And what I mean by that is when you're looking at medicine, you should be looking at like your dentist. We should be trying to work ourselves out of a job. Meaning, you're doing things so that people don't have to come back to you. I mean, whatever it is that the gear is really to get people well so that they can live on happy, healthy, content lives. And they should only be seeing us for acute problems that we can actually address. And that sort of led me into the pain world. I was like, why is all this stuff that I was trained to do not getting people well? Why do they have to keep coming back to me? I found a lot of information on chronic pain. A lot of the stuff that I had been taught wasn't necessarily true. A lot of the therapies that we were doing, really the evidence was poor. And then I started looking at the whole healthcare system in general and sort of looking at the same thing. What is it we're doing in healthcare? What is it that we actually treat? How are we treating things? What are the tools that we have? And when you look at the way that our healthcare dollars are spent, 70% of all money, at least in the United States, 70% of healthcare dollars are spent on the treatment of chronic diseases. And if you look at treatment of chronic diseases, there are a lot of medications in use. You look at 50% of the American population is on one prescription drug. 20% of the U.S. population is taking 5 or more prescription drugs. And a lot of these drugs are for things that they're for symptoms, which means symptoms are things that you feel, not necessarily the disease process itself. And there's no endpoint with them. There's not a lot of impetus to get somebody off. In particular, our healthcare system, people just tend to get these things stacked on and on and on. And the underlying thing that may be causing it, the underlying thing that actually is the disease process, just gets neglected. So that was started my whole interest in kind of all this stuff in the journey that I've been taking.
And I've jotted down a couple of notes from the things that you've said. I really like that analogy of the dentist and how we should be more like dentists and try to work our way out of a job and empowering and educating, clients and patients to take their own personal responsibility. Because I think in general, either dentists have kind of maintained the same when it comes to numbers that are out there or actually decreased. So it's kind of nice. I know I get, my philosophy when it comes to the injury side of things is like, I want to empower the client so they don't need me. I don't want to be around forever. I want to educate them on the things that they can do in order to overcome their injury or pain. I don't want a therapist model where they become dependent upon me in order to deal with their pain or overcome it.
Absolutely. And if you kind of look at those models where we promote that behavior, people have worse outcomes. People don't get better. They become, as you said, dependent on it. They have a transition in the coping skills that they use for whatever the problem is, from what are known as active, engaged therapies into a passive modality where, someone else needs to help me do this. It's disempowering. It hurts people. It kind of traps them into a model where they can't escape. And absolutely, and I don't know if that's the topic today, but I could definitely talk about that as well. It just frustrates me to no end.
I know. We talked at Orange County at a conference, and I didn't really need to prepare very hard for this interview because I know just from your responses, more and more questions would come up. Another thing that you brought up was there is money in keeping people ill and keeping people chronically ill and in chronic pain, and it's sad to think. It's sad to think that it's more beneficial to a lot of companies to keep people ill for a long period of time as opposed to curing them and getting them better right away.
Well, if you just look at the pharmaceutical industry in general, I mean, again, we're looking at the treatment of chronic diseases. The vast majority of chronic disease are what we call diseases of behavior and lifestyle, right? They're either you don't move too much, you're eating the wrong things, you are in the bad environment, you're doing things to yourself that are harmful, toxic stuff like smoking, drug use, or even toxic people, being in bad environments where you have this high stress environment and we don't have a way around that. And rather than addressing the issues that cause those or propagate those chronic diseases, if you give someone a drug and then say, well, you need this drug for this chronic disease, but you don't change any of those underlying factors, that person's stuck for the rest of their life. Now, the other part about that is if you haven't addressed those issues, it's like slapping a Band-Aid on a cut that needs to be either stitched up or have the pus drained out of it. It's just going to continue to get worse over time. And what that leads to either higher doses of the medication, addition of other medications, stronger medications, whatever the case may be. So it's a downward spiral model, and it is unfortunately it does. As I said, makes a lot of money. If you look at just pharma marketing and what the best-selling drugs are, the top 5 drugs in 2014 alone were all for chronic diseases. And we're moving into a psychiatric drug, Abilify, which was the top drug for drug sales in 2014 and 2013, that was originally indicated for schizophrenia. And what they did then is they expanded the diagnosis. They pushed for it to get things such as bipolar disease, clinical depression, irritability due to autism, Tourette's syndrome, all these sort of other things. They look for these other educations because there's only so many people that have schizophrenia, and that's a limited market. So what do you do when you have this expensive drug? Hey, let's look for other things that we can treat for it. But other ones that they have, Nexium for heartburn, high cholesterol medications. Those were like the huge drugs back in the early 2000s, where they really aggressively went after statins. They actually created this awareness of hypercholesterolemia and cholesterol being the bad thing, and that it was the enemy of everything, and we needed to take these medications, which is interestingly being changed now as we start looking back on the data that was, quite frankly, poor, and a lot of the dietary recommendations that we originally gave were off and not true. But all those drugs are moving off of patent now, and so you have to move to the new drugs that are patented, that don't have a generic indication. And as I said, so the top 5 drugs are all for sales are all non-generic medications, and therefore chronic disease.
And you bring up a good point when it comes to the cause side of things. I know a situation I often get into is people ask me, well, what are some exercises that I can do for blank from, for example, my shoulder? And a lot of times you got to take a step back and look and see what's causing that shoulder pain. If you're sleeping in a horrible position, if you're doing activities unnecessarily that put unnecessary stress on your shoulder, it's just not going to allow your shoulder to recover properly or heal properly. So you got to find that issue that's kind of causing it, as opposed to just band-aiding it with other things. And interesting thing what you're saying, so maybe kind of explain a little bit on what's the process out there on how a pharmaceutical company can kind of expand the market for a medication. So you're saying a certain medication was targeted to a specific group, and then they worked on expanding it to be beneficial to other groups. How do they make that happen or acceptable out in the medical community?
Well, it's actually wickedly smart. I mean, these guys, if you look at the marketing they use, it's just actually genius. First they have the drug, and then they have to look around at what other conditions are being treated. And for this little standpoint here, I'm just going to put a little caveat. Right now, I'm just sort of imagining how they do it because I don't have the data on this. But my suspicion is they start looking for diseases that don't have a lot of competition, or either they have a high degree of competition. So they're looking at things that have a large population there that don't have a lot of drugs that are being treated. And so once they've identified that, then they start finding either patient groups, patient advocate groups, these groups of what are supposed to be grassroots, where these people have these conditions and are trying to promote awareness of it. Or in some cases, they actually start their own nonprofit foundation saying, this is a big problem, we all need to be aware of it. Then they start looking at physician partners in a lot of ways. So they start looking at academic physicians that are doing research that may have not, they may be looking at the pinnacle, like the people who have horrible disease as it is, And then they expand that diagnosis with them, and they start promoting educational materials to physicians themselves. So they start treating physicians. They start telling physicians to be more aware about whatever the symptom is, more aware about this disease process so that it can be treated. Now, there's a couple interesting examples that just happened in the last year. One was for something called binge eating disorder, BED. I don't know if you've seen the commercials for that. And that basically is, it doesn't fit into our standard medical diagnoses. There's anorexia, where the people who don't eat enough. That's a horrible, awful disease. It kills a lot of people. And then you have bulimia, whereas the people that have a tendency to eat, overeat, and then they purge, where they throw up after they're done. All right, both of those can be very serious conditions. Now, binge eating disorder is just people that eat a lot of food at certain intervals, enough that it just seems to be uncomfortable for them. Now, there are some people, well, yes, this is a serious problem. Some, but not nearly the amount that they're trying to promote. And so this particular drug company that has gotten slapped in the past for doing some bad marketing had a drug for attention deficit hyperactivity disorder, which incidentally was another drug that they promoted awareness of in the early 90s, or that's another disease they promoted awareness of. They took the same drug and they said, well, where else can we use this? And they found this kind of orphan process here, binge eating disease. And now they're marketing this hard. In fact, binge eating disorder was just pronounced, it got its own diagnosis code and the newest definition of the psychiatric manual, DSM-5, in 2013. And right on the heels of that, they have now websites about binge eating disorder, what the symptoms are, which is if you eat too much food here and there, if you overeat at times, you may have binge eating disorder. Talk to your doctor about this. If you don't get the answer you want, keep pushing for it. It's absolutely fascinating. And then there's another one I just found today when I was doing some a little background before this interview, and it's for constipation. I couldn't even believe this one. I was actually looking up some data on another drug, and there's a pharma ad directly on this webpage of a very prominent website talking about chronic idiopathic constipation. It means you have constipation and it's there, and we don't really know exactly why. Now, the most common reasons you have constipation is because you're not moving, you have a low-fiber diet, and you're not eating enough food, or you're not eating enough water, right? The things that actually help with bowel motility. But in this situation, we're going to promote this awareness of chronic constipation, and in this now you need a drug for it. Now you have a name that you can label it instead of having, I'm just not eating right and my bowels are tight. It now becomes, I have chronic idiopathic constipation. I need a prescription from my doctor to help this, symptom along its merry way here. So that's just two, in the last year. There's just a host of them. If you look at all these diseases over the years. Now, I want people to know I'm not trying to discount things. There are some serious, serious problems out there, but they're the tip of the iceberg. In majority of these processes, they're a minority of the population, right? So if you look at things like depression, clinical depression is a horrendous disease. Has a huge risk of mortality associated with it. It kills a lot of people, and not just from suicide. We're talking accelerated heart disease. They catch infections easier. They die easier from a host of different problems. Anxiety is similar, etc. But we can take these diseases and then we can just sort of say, well, let's expand the criteria. Are you feeling unhappy all the time? Well, now we have non-clinical depression in this situation. Let's try to, advertise that you use a drug for that. Again, drugs aren't as well as certain things like movement, exercise. Some of our sizes of therapy that don't rely on drugs have a little bit better indication for that. Or another one is shyness. In the late 90s, social anxiety disorder became on the picture, which was another name for shyness. And what is interesting about shyness is they promoted this drug to treat social anxiety disorder, to make you want to go out and have be able to talk into groups or whatever, without really looking at the symptom. Why are people shy? Some people may be just more introverted. Not necessarily it's a bad thing or not. Other people may be avoiding large groups because they've had horrible traumatic events in the past. If they were a victim of abuse, either as a child or as an adult, there's a reason that they may not want to get into large groups. And then rather than drugging them and calling them, you have a problem with shyness, how about actually looking at the reasons behind it, if there is a true reason to have, a true reason or a true disease that we need to treat, and then get them the therapy they need, rather than slapping a Band-Aid on it and just saying, here, take this pill, it'll make you happy, and you'll go out and talk with your friends, even if there's other reasons you may not want to do it.
So when it comes to businesses, specifically pharmaceutical companies, they kind of create this strategy in order to market or market to an audience or actually create the audience out there. It's almost a rough plan that they end up doing, following these steps, looking for a market that's competitive or needs to be serviced, starting to create awareness out there, contacting the experts, contacting different support groups or creating support groups out there, and then educating the doctors, and then finally educating the consumer, because that's probably the most expensive step, is educating the consumer so they go to their doctor and ask for this medication.
Yeah, and if you sort of look at what gives you the most bang for your buck, now direct-to-consumer advertising in the United States started in 1998, and it's been expanding every year. And we do see a greater push with the rate of prescription drugs, particularly ones that are being heavily marketed on TV. But if you really, really want to get people to, or if you really want to promote a medication, the way that you target is the gatekeepers, and that's the drugs, or not the drugs, that's the doctors themselves. So you have to promote an awareness within the doctor community about these new diseases, and or support what this drug may create for it. And in some cases, you promote a false sense of this is a superior drug to something that is generic, commonly available, or other therapies that as I said, just by behavioral and lifestyle modification, that somehow this drug is better than that. So it's very interesting, because as physicians, I don't want to get myself in trouble here, but this is absolutely true. We're pretty arrogant, right? I mean, we went to a lot of years of school. We're supposed to be the smart person in the room. We want to be able to tell people what they have. And in most situations, we don't know exactly what it is. We're very good at telling you what you don't have, the horrible, awful things that kill you. We can generally just exclude cancer, horrible infections, and things like that. But various other symptoms, which are really actually life symptoms. If you're stressed and you're having headaches here, or if you're actually feeling worn and fatigued and it may be related to your job, we're not really good at picking out all those little other things that could, and we don't have the time, to be honest, to actually pick into all those lifestyle reasons that people may having these symptoms. And so it becomes much easier to say, well, you got this, and here's a drug for it. And it makes the encounter much quicker. It makes makes us feel better because we can say we can do something for you. It is completely not satisfying to say, well, you have this, and really there is no good medical treatments for it. There's a false expectation there, and so we will fill that expectation. In a lot of ways, we're treating ourselves because we feel better by doing something than by not doing something, if that makes any sense.
Yeah, I mean, you naturally want to help someone, and one way that you can do that is by prescribing a certain medication to help them.
Yeah, it's an action, and it's like anything. Sometimes if you're a parent and your kids fall down, or your kids are having difficulty with things, some of the things that we need to do is we actually have to let our kids fall down. We have to let them scrape their knees. We have to let them stand up on their own. We're not there if we're there all the time and we don't let them fall. They're not learning anything. They're not getting better. They're not able to actually develop as children in the best way. And so we can actually inhibit the growth of our children. And I'm looking at this and I'm kind of hearing myself speak as a listener here. I'm not trying to say, again, not a paternalistic way on this. I'm just saying basically is there are some things that we cannot treat. And when we try to treat or address them or provide the pill, we actually worsen it. We delay the chance for the patient to actually take control of their own health. We promote a view of sickness, that there is something that they can't do for themselves, that they must have a pill or something from the doctor. And so we're keeping them from being able to get well, just like we were talking about at the beginning of what we were talking about in the beginning when we were talking about we want people to get well. Really the goal is to get people to live full, happy, healthy lives, and only need to use medical care for things that acute conditions, having a heart attack, etc., or to rule out horrible, awful things that may be going on, and then go back to living healthily again. That's really what we should be doing.
Mm-hmm. And the stats are high when it's like, if you end up, what is the risk, or what percentage of people after they have one chronic condition, how many of them end up having multiples within a couple of years? It ends up being high. If you end up having one chronic condition, you're more likely to get other chronic conditions. And then you're mixing all these medications to deal with all kinds of different things.
Oh, absolutely. So if you're looking at things like hypertension, high cholesterol, heart disease in a lot of ways, what's the commonalities to them is the behavioral changes that need to be done is you need to exercise, right? You have to move some, and it doesn't even have to be that much. I mean, there's some stunning data that moderate exercise 3 times a week, not even the 150 minutes they were saying, decreases mortality like in half, but some sort of movement, eating real food. How about, avoiding complex, these carbohydrates, these simple carbohydrates, these white foods, eating real food, plants that, this is not like rocket science anyway, but eating real food, and then avoiding bad things we talk about. And the last one, as I said, is stress. But if you're just doing those, treats all of those chronic conditions. I was talking about pain, so I was looking at pain. What were ways that encouraged people that had better outcomes with pain? And they were those four things: people that actually exercised, moved, that people were eating and weren't obese, people that were addressing stressors in their lives and that were not smoking or doing other harmful substances, or were in a high stress environment, had better outcomes with pain. Then I started looking at cardiovascular disease. What's the same 4 things? Same exact 4 things. Gastrointestinal disease. Basically, all of these chronic conditions, there are only 4 things that you really need to focus on. And if you don't, and we cover up whatever the symptom may be with a drug, then you will eventually, it's like putting a piece of gum on a leaky pot, right? There's cracks, and as the cracks get bigger, it's going to start spurting out somewhere else. So we have these vulnerabilities, and if you don't actually address whatever is the root cause of them, which there's basically 4 things, you're going to start popping little leaks in different areas, and we'll have different drugs to kind of put a Band-Aid on there.
Oh, that's a really good point about the 4 things.